If you're dealing with Graves' disease or know someone that does have this horrible autoimmune condition, you know how challenging it can be. On this video, I'm going to share with you the top 8 supplements that you can use to help with this condition. I'm Dr. Jake. I'm a naturopathic doctor, and on this channel, I share with you how you can heal your body down to the root causes without any harmful drugs or surgery. Make sure to subscribe for more videos like this one. Okay, let's jump in. Let's start talking about what is Graves' disease, what does it do to the body, and why you want to even do anything about it. So Graves' disease is an autoimmune condition of the thyroid. So there's two autoimmune conditions that we talk a lot about of the thyroid. One is Hashimoto's and another one is Graves'. And they do completely opposite things. Hashimoto's suppresses your thyroid, so you don't make enough thyroid hormone. And Graves' disease makes your body make too much thyroid hormone. So completely different conditions, completely different treatments that we do for each condition. So you're producing way too much thyroid. And what that does is it's going to make you become hyper. Pretty much an easy way of thinking of it. You're going to not sleep well. You're going to be jittery. Your heart's going to race. You're going to be anxious. All these symptoms go along with Graves' disease, even though there are some people that have had to have Graves' disease that have a completely opposite effect that actually get the hypothyroidism type of symptoms, but majority of people, 99% of people have those symptoms that I just talked to you about. And it's horrible. Patients hate this because they're not sleeping. They're anxious all the time. They're worrying about everything out there, and their hearts are just blowing out of the charts whenever they exercise or even go up the stairs, and they feel absolutely horrible. So a lot of the treatments we're going to be talking about is going to be helping calm this thyroid down and work on the autoimmune condition, the inflammatory response that's happening to the thyroid. So can patients get elimination of their disease and not actually have to get their thyroid taken out or take radioactive iodine, which is the most common suggestion? If you get diagnosed with Graves' disease, they're going to put you on that. They might put you on a little med for a little bit, but their main goal is really saying, hey, you're going to be on this just for a little bit, but then we're going to take your thyroid out. But yes, I've treated a lot of patients with Graves' disease, and we definitely can put them into a remission state on their laboratory numbers that they aren't showing that they have Graves' disease anymore. But they can't live absolutely not being aware of their disease anymore. I mean, if they go off their diet or they stop any of their supplements, the disease is going to definitely come back. But we can help it be at bay and not experience any more symptoms and really live your normal life if you do the right things that we're going to talk about today. So let's dive in, talk about the therapies that I use and the supplements that I use to actually help with Graves' disease. One I would like to start with is a nutrient very common called selenium. Selenium has been shown in the literature that it helps with quality of life. And it makes a lot of sense as selenium helps balance out the thyroid. It actually helps the thyroid work better. So if you give something that actually supports the thyroid, you should see some suggestions. Some people might be thinking, oh, you give something to support the thyroid, that's going to make you actually make more thyroid hormone. Not really. You're just making the thyroid work how it's supposed to more readily when we use selenium. And we have seen in the research that it improves quality of life when you take 200 micrograms per day of selenium. Let's dive into another nutrient that we like to use for this. It is L-carnitine. When you're taking a supplemental form of this, I like to use a different form called acetyl-L-carnitine. L-carnitine is hard to absorb, and when you add that acetyl group, it helps it get much more readily absorbed into our bloodstream. And this has been shown to help decrease symptoms. The symptoms we talked about are heart palpitations, heart racing, not sleeping well, jittery, etc. Acetyl-L-carnitine can help. And in this form, I usually take about 1,200 milligrams per day, 600 milligrams twice daily. In the beginning, you could go twice that dose. If you're just taking L-carnitine, you need to go to more like 3 to 5 grams because it doesn't get absorbed as well. Next one that I want to talk about is one of my favorite vitamins, which I wouldn't even call a vitamin, is vitamin D. So vitamin D is more like a hormone. It's a modulator of our immune system. If we want to talk about a hormone that actually has an effect on our immune system, the greatest, it's vitamin D. It's going to modulate that inflammatory response in the thyroid. So it's actually going after the true cause of Graves' disease, which is your immune system is tackling the thyroid, and taking vitamin D can help actually decrease that effect that is happening. Let's talk about what is the dose of vitamin D. The dose varies person to person, 2,000 to 5,000 IU, but my recommendation is you go to a doctor and get your values checked. I like to see your blood serum levels at 50 to 70 to really have a good effect. So it's hard to say, oh, this is the perfect dose for you. You really need to get your blood checked, see where you're at, and then start with a doctor that knows how to prescribe it appropriately and keep on getting your blood checks until you get the perfect dose for you. But 2,000 to 5,000 usually is the dose most people need. Is 2,000 to 5,000 IU actually going to cause you to overdose? There is a possibility there. Usually 2,000 IU doesn't do that, but I've seen people get too high on 2,000 IU. So that's why I recommend you need to actually get your blood checked. And vitamin D is a fat soluble vitamin, and it is something that you could easily overdose on. So you just need to be aware and go to a doctor that knows how to order these tests. Now I would like to talk about 3 herbs that I really love for going after Graves' disease. And I really wouldn't be able to treat Graves' disease well if I didn't have these herbs. My favorite one, the best one of all, is called Bugleweed. It works great. It actually suppresses your thyroid production of thyroid hormone. So it actually goes after the cause of what's causing it happening. So the autoimmune response makes your thyroid go crazy for some reason and start making way too much thyroid hormone. And bugleweed has been able to decrease your thyroid production in a good, healthy way. Another herb I would like to talk about is called Motherwort. This has direct cardiovascular benefits. So a big scary thing about Graves' disease, it can make your heart pump too fast, and this can make your heart maybe get tired and maybe lead to long-term congestive heart failure or maybe arrhythmia issues. Helps calm that heart down, decreases the racy heart aspects that go along with Graves' disease. Next one that I would like to talk about is Melissa officinalis, also known as lemon balm. This is a very calming herb. I've seen this work very well for my patients that have Graves' disease. It calms that anxiety, chills the patient out, and helps them sleep better. So let's talk about like the best form of taking these herbs. I usually like to do these herbs in a tincture. It's how I always prescribe it. I do usually a combination of these two, and I do like 1 to 2 milliliters, depending on the patient, 4 times a day. But you need to be a little bit careful with bugleweed because if you take bugleweed, you take too much of it, it can be a problem. So you don't want to go above 1 to 2 milliliters of pure bugleweed. The others you want to take probably about 1 milliliter of each of those, which is like 1 dropper full, up to 2 dropperfuls with Motherwort or Melissa officinalis. So how do you take a tincture? So what you do is typically if you put it straight in your mouth, it's got some alcohol in there. It's going to be pretty burny and most people don't enjoy that. So you put in a little bit of water, maybe a fourth cup of water, put it in there, switch it around, and just gulp it down. So are these herbs tasty or are they more bitter? These herbs are generally a little bit bitter. My patients don't complain too much about it, but it is kind of yucky. If you really don't like it that much, you could add it to grapefruit juice. That uses masks things pretty well. So that could be a good option for you if you really hate the flavor of the tincture. Have I seen in my personal practice someone take way too much bugleweed and then put them in hypothyroid, so they're making too little thyroid? No, I prescribe it and my patients usually follow that. And I haven't had anyone come into my office. I was just taking it off the street, not knowing how to prescribe it, actually cause hypothyroidism. So if you take too much bugleweed, it will cause your thyroid to shut down and you'll get all the symptoms of hypothyroidism, but also it will cause you to vomit, diarrhea, possibly if you take way too much, go into a coma. So you got to be careful with it. You can't take too much of it because it could cause big problems. There's some herbs that are like, oh, who cares? You could take a ton of this. It's not going to cause a problem. And there's certain herbs you definitely need to be careful with, and bugleweed is one of those. The last supplement that I recommend to my patients for Graves' disease is omega-3 fatty acids. So what's great about that? It's actually going after the cause. It's decreasing that inflammatory response of the thyroid gland. What's great about it is it actually works on the cell itself, the phospholipid bilayer of the cell, and it replaces those inflammatory phospholipids in that cell and actually replaces it with the anti-inflammatory omega-3 fatty acids. So it changes the cell completely into an anti-inflammatory cell. So I really love it because it does that. And we've seen in the research that it has a great immune modulatory effect on the thyroid and decreasing the TSI number. That is the number that actually checks the autoimmunity, and fish oil does great for that. So usually omega-3 fatty acids, we're going to be taking about 2 to 3 grams per day of that. You can maybe go a little higher depending on the patient and how much they weigh, but that's the average dose. Yeah, if you want to get a hold of me, visit my website, integrativemedica.com. Find my phone number there. Give my receptionist a call and set up an appointment with me. You could also set up an appointment directly from our website. If you want to learn more about Graves' disease, click the video to the right where I go into an in depth case study in which I helped a patient go into remission.